Every year, heart and lung diseases take the lives of millions around the globe. Diseases like cardiovascular disease, COPD, and asthma affect more than a billion people worldwide, reducing their quality of life and increasing their risk for premature death.
The current approaches for addressing these diseases fall into two main categories. The first seek to address the disease as early as possible, commonly known as early intervention. Many heart and lung diseases are preventable, or at least less burdening if addressed earlier. Recent years have seen progress in early prediction, sparking a surge in at-home medical tools for monitoring and testing. The second strategy focuses on treatment optimization. This approach is more standard and aims to slow the disease's progression in those already diagnosed and minimize the symptoms with medication. Unfortunately, both strategies have their shortcomings. The market for early diagnostics often assumes that patients already know their symptoms or only targets highly health conscious patients, thereby missing a broad segment of the population. Additionally, many treatment plans lack personalization, failing to meet each other's unique needs based on when they experience their symptoms.
Hi, I'm Vatsal Sivaratri,
I'm Dhanvanth Sairam.
And I'm Srijan Kalla.
and we are the founders of CPATS, a novel system to predict, screen, and manage heart and lung diseases with an emphasis on early intervention and treatment optimization.
Our product presents a three-step patient pathway to treat patients. These steps highlight a framework that uses both early detection and treatment optimization for patients to manage their disease. For early intervention, we leverage the sensors in consumer smartwatches to securely collect data continuously before the patient's first appointment. With the rising popularity of smartwatches, we chose to harness this technology for non-invasive diagnostics that are cost-effective and realistic. But why does this work? Today's smartwatches and trackers are more than just timekeepers. They're equipped with sensors that can monitor vital health metrics. ECG sensors track the heart's electrical activity, PPG sensors detect changes in blood volume, and SpO2 sensors measure oxygen levels in the blood. Together, these tools can spot irregular heart rhythms, which are often early signs of heart and lung issues.
After patients visit their doctor and establish a treatment plan, our innovation shines on our emphasis on treatment optimization. We created a hardware drug delivery system to administer treatment for patients. In practice, our hardware and software work together to determine the best times to deliver a drug concentration. To monitor patients for these best times, we use both smartwatch sensors and doctor prescriptions. Research has shown that patients with chronic heart and lung diseases have predictable patterns of when symptoms show up, often known as episodes. This means that we can optimize the time we take our treatment to reduce the likelihood of experiencing an episode at some predicted time. The 3D printed embodiment is designed to ergonomically fit around the patient's arm and also houses the Raspberry Pi, stepper motor, and a custom designed track and pinion arrangement. The Raspberry Pi 5 is configured to respond to incoming requests using a secure web server. A Flask application is written to host a web server at a specific port. Client devices like smartphones and smartwatches can initiate drug delivery as and when needed. When the Pi receives a request from the web server, it initiates the servo motor to move the gears for the rack and pinion, which moves the drug delivery apparatus. To put our idea into perspective, let's look at a scenario. Imagine a middle-aged woman named Alaya living in Afghanistan. Alaya has a low-income job, and thus she often restricts her diet to cheaper foods, some of which also happen to be high in saturated fat, a big contributor to heart failure. Because Alaya is using her application, we notify her early on that her consistent coughing and chest pain are indicators of arrhythmia, which motivate her to seek an appointment with her doctor. There, she is diagnosed with early-stage heart failure, and her doctor prescribes her 0.25 milligrams of intravenous digoxin twice a day, anytime in the morning and evening. He also recommends her to cut all her unhealthy eating habits. CPATS uses the smartwatch sensors to continuously track when Alaya experiences these episodes, understanding her unique patient profile. Using this data, it creates a medication schedule that adheres to the doctor's restrictions, while taking into consideration the properties of the drug itself and when she specifically needs it the most.
Our strategy canvas illustrates how we set ourselves apart in key areas. We prioritize bespoke delivery and continuous monitoring, offering high levels of personalization and real-time health tracking. While maintaining competitive pricing, we also focus on form factor, ensuring our devices are user-friendly. Updates are frequent, keeping our technology at the cutting edge, and our battery standby time outperforms the standard, minimizing the need for frequent recharging. Our ERRC grid highlights our impact on multiple fronts. We seek to eliminate manual patient intervention and reduce the frequency of visits and the disease treatment time. We significantly raise the bar for early diagnosis and create tailored drug delivery and an ergonomic hardware device. CPATs will initially serve tech-savvy adults who value their health, but aims to reach health-aware non-tech users next, and ultimately plans to expand to rural communities and small healthcare providers not yet adopting remote health monitoring and treatment.
With CPATS, we're not just creating a product, we're revolutionizing the approach to cardiopulmonary healthcare, making it more accessible, personalized, and effective. Join us in unlocking the future of cardiopulmonary health with advanced personalized healthcare.